Hi everyone, it is Jo, and today's video is to hypothesize really. I've got some ideas. I've been thinking a bit about a disorder called tic disorder and Healy, microfrequency therapy work, and I had some ideas which I thought I'd run by you, see what you think, and maybe you can help me work through some of this, because as a clinical psychologist I am seeing a lot of particularly younger people, so children, presenting with tic disorders or similarly related impulse control disorders like trichotillomania, which is the hair pulling. And gee, I'm seeing a few actually. There's a few, and the children are pulling their hair to the point that, you know, in some cases they've got big chunks missing from their hair. With the tic disorders, we're seeing kids that are either hitting themselves or eye rolling, any kind of verbal or motor tic. So it might be making noises, might be making sounds that they say they feel that they can't control. Now I question this. I believe there is that lack of impulse, and I believe there's this strong urge for a child to engage in whatever that tic behaviour is. But I don't accept that they can't control it. So not being able to control it and pardon me, being challenged in controlling it are two different things. And I'm going to talk to you about that. So with tics, they are considered, they used to be impulse control disorders, but in this DSM-5, so this is the Psychologist and Psychiatrist Diagnostic Manual, it's now moved to the category of neurodevelopmental disorders. Neurodevelopmental. Now, neurodevelopmental disorders, things like ADHD, what else is there? Intellectual disability, autism. These are considered lifelong conditions, really, that are affecting the nervous system. So they lead to abnormal brain function, and that then impacts systems like emotion, learning, mood, self-control, and even memory. Now, the thing with telling someone that they have a neurodevelopmental / lifelong condition, as opposed to this is a behaviour that you can control, that you have got full control over. Although change is hard, I acknowledge, but there's a very different message to say that something's neurodevelopmental. It's a problem in your nervous system. There's nothing you can do about it. You'll probably need medication. It's lifelong. What a disempowering message that is. You know, and when we think about what causes, or what the literature, this is not me speculating the causes, but what the literature sort of indicates is that stress and sleep deprivation impact tics. Certainly they bring it on with a lot of immune conditions, autoimmune conditions, even multiple sclerosis, diabetes type 1, irritable bowel syndrome. We know definitively that stress and sleep impact symptom re-emergence in these conditions. So the other thing with tics is, particularly with children, is medication. Now, I don't think this one gets enough attention. So there's a condition called Pediatric Autoimmune Neuropsychiatric Disorder associated with Streptococcal infection. Now, if you break down those words into an acronym, it's called PANDAS, PANDAS, Pediatric Autoimmune Neuropsychiatric Disorder associated with Streptococcal infection. And what we have found is that when the medication, or not necessarily medication, but when, when a person or a child contracts the virus, the Streptococcal virus, their body turns on itself, much like an autoimmune condition. And something happens and crosses the blood-brain barrier. And you get parents saying that one day their child was normal, and then the next day they woke up and basically had a tic. When I then inquire a little bit further and say, did they have a sore throat, did they have, a cough or different things, often we find that they did. So there is this known association between streptococcal infection, which is a very common infection in childhood. A lot of the times there's not even any symptoms. You won't even know your child has it. And this acute, sudden, abrupt onset of tics. So that's something very different. Again, it's an acquired problem now. That's not something you're born with. That's not necessarily neurodevelopmental, though it could turn into be a condition that impacts your nervous system in some known way. but it's acquired through the introduction of a virus or a pathogen of some sort, or, as we know, with some medication. So there's also PANS, P-A-N-S, and that's Pediatric Acute Onset Neuropsychiatric Syndrome, which is another condition again. But these are these acute presentations. So if you've got a child that has pretty much all of a sudden started to display tics when before they didn't have it, maybe they were a bit anxious before. A lot of kids are quite anxious because we teach children anxiety too. A lot of anxious kids have anxious parents. I know. I'm a very anxious person, and my child has had tic disorder too. And it was a quiet and abrupt onset. And in fact, I have another video on this YouTube channel that you can have a look at, and you can see my son's eye-rolling tics, which we successfully rid him of as well. Every now and then they'll re-emerge temporarily, but they are not lifelong, and they're not neurodevelopmental in nature. So we need to think about this. So when our bodies, and this is where Healy will come into it, but when our bodies are under stress, our brain waves are at a particular frequency. So we know that the stress state is producing these beta waves, a beta wave phenomenon. So, if we're looking at beta waves, and I'm going to pull up some stuff behind me so I can refer to this, but beta waves are brain waves that are typically occurring between 13 and 40 hertz. And these brain waves, whilst they're also associated with being very alert, because when you're in that fight-flight response, you're very alert, everything's on, but they're also associated with the stress response. So these are happening at a particular frequency. And there's a psychiatric intervention that it's been around for a couple of decades, but in psychiatry we still consider that a pretty new concept, but it's called Neuro Feedback. And it's been the subject of the study of researchers for a while now. But neurofeedback is a method that assists subjects, or it's a very scientific word, people, to control their brain waves consciously. So we actually can impact these autonomic nervous systems. We can impact the respiratory rate, our heart rate, our blood pressure, our brain waves. We can actually modify these, mediate these outputs. So we are not these passive recipients. We have more control than we are given credit for. And certainly, we need to be exploring this more rather than thinking we're passive recipients, we've got no control, this is lifelong, there's nothing we can do. We need to be learning this stuff. So when we do electroencephalography, this is the EEG. So this is where we put the little electrodes on a person's head, different areas of their brain, and measuring the brain waves. We're noticing that these tics, these particular behaviors are occurring in the beta state when someone's really alert. So what we do through neurofeedback is we teach people how to control that and how to change their brain state. We teach them relaxation, meditation, self-soothing, all these things that will lower their blood pressure, reduce their heart rate, and also decrease their brainwave output through the EEG monitoring. And then what we find is that when someone comes from a beta brainwave state down into an alpha brainwave, so now we're, instead of 13 to 40 hertz, an alpha is about 7 to 13, they are now producing a state of calm, a state of relaxation. This is where meditation starts to begin. And it says up here that, the mind chatter slows down. So those thoughts in the head, it's great for learning and it's great for studying. So this is the state, that's going to be helpful to us, the alpha state. It creates ideas, it allows us to relax, can reverse brain aging, habits, fears, phobias can be started to be ebbed away in this brain state. So we want to get, the brain wave or very stressed brain response down into an alpha wave. And then we want to introduce some of the psychological interventions, the evidence-based interventions that we do in psychology through cognitive behavioural therapies or through exposure response prevention, ERP, which we use with OCD and tic disorder. But then we've got theta brainwaves, which is now down to 4 to 7 hertz, or in deep sleep, where you've got that calm associated with deep dreamless sleep brainwave, that delta brainwave, which is 0 to 4 hertz. So what I'm getting at is whilst we're using something like Healy to influence brainwave states or frequencies, we're introducing frequencies into our body, we should be considering how these frequencies might override that neurofeedback kind of intervention where we're forcefully training, consciously, purposefully training someone to change their brain state rather than actively doing it, allowing the frequencies, the micro frequencies, to resonate where they're needed, to allow us to just gently and calmly and without force or even conscientious intention be induced into a state of alpha or even theta, brainwave activity. And this is where I think healing is going to occur. So whether we can do that, I would say in combination with our CBTs and our ERP therapies, but certainly as a standalone therapy would be really interesting. So when we're dealing with young children, and I've got one in my clinic at the moment, a 3-year-old who's presenting with some kinds of tics, certainly anxiety and trichotillomania, the hair pulling. They're too little to really work at that verbal level, of instruction and feedback. We need something that's just going to overwrite that. And I'm thinking that maybe these frequencies, the microfrequency therapy, could do that. Now, this is speculation. This is a hypothesis, and this is something I want to explore because at the moment, if you go onto PubMed or Google Scholar and you put in tic disorder or even anxiety disorder, certainly you won't find trichotillomania and microfrequencies co-occurring. There's just nothing there. There's a lot of research on microfrequency therapy, but not in the context of specific presentations or particular populations. So I'm looking at tics in a young population with microfrequency therapy, and there's nothing there. So what I'm going to do, obviously with the consent and the full knowledge, informed consent of my patients, is to start testing this. So that little child that I'm referring to, I'm going to speak to the parents and see if they're willing to try this. And I'm going to put the Healy on them. We know it's not going to cause any harm. But I'm really curious to see, can we override this? Can we adjust the frequencies of that stress state, the tic disordered state, and induce a calm, relaxed alpha state where natural healing will occur? That's a very different proposition to you have a neurodevelopmental disorder that is lifelong and not much we can do. Here's some medication, when the medication itself might cause more side effects or might actually increase or escalate the symptoms we're trying to treat. And that happens a lot in psychiatry. It's called paradoxical side effects. When you're trying to treat someone with depression who has suicidal ideation and you give them Prozac and their suicidal ideation increases, paradoxical side effects happens quite a bit. So let's try this. My question to you is, if you live locally, I'd love to talk to you. If you don't, then we can speak over Zoom. But if you've got a child that has tics, and if you've got a Healy, I'd be curious if we can use some of the particular programs, or we can create a frequency program on Healy that's going to induce this alpha or theta state. And then we can supplement that with some of these therapies that I do, these evidence-based therapies in psychology, and have a look at the synergistic effect of both the psychological intervention with the microfrequency therapy in the context of young children with tic disorder. That's what I would like to do. So if that does impact you, or you know someone who has a young person with tic disorder, let me know, because I think the only way we're really going to be able to, talk about how wonderful Healy is if it's backed up with some scientific, some empirical research, some rigorous scientific investigation, and we need that. I have faith that it's helping a lot of people through that anecdotal testimonials that I'm hearing and that you can read about everywhere. People are talking about their own personal healing or their own personal situations where the microfrequency has helped them, but I think we need some more rigorous evidence. So that's it for now. That's an area that I'm really interested in. As you know, I'm also interested in the effect of microfrequency therapy in neurodegeneration, and I would like to look at both these things a little bit more comprehensively in the near future. But to do that, I would like some interest. So if you are interested in participating, or you want to know more about tics or neurodegeneration, you know where to find me. My Gmail is energymedicine777 gmail.com. You can email me there, or you can write a message below, and I'd be really happy to hear from you. All right, that's it for now. Tomorrow is the first day of winter, but I live in Queensland, Australia, so, it's not really winter. I think the coldest day gets down to about 16 degrees Celsius. I don't know what that is in Fahrenheit, but I do know it's not very cold. So for me, it's cold. I've climatised, so anything under about 20 degrees for me, I need a jumper. But tomorrow, the first day of winter, so wherever you are, have a happy, peace-filled day. Look after yourselves and each other, and we will talk again soon. Take care. Bye-bye.